Raman Dhanoa, speaking about Smart on FHIR apps.
Thank you. Hi, everyone. This is Raman. I'm here to talk about Smart on FHIR mobile apps. This is basically, I wouldn't say fully in production. It's a production-ready reference implementations that we have built for one of the physical activity implementation guide out there. So today, my focus will be demoing the app. Along with that, I'll be also talking about how did we integrate Apple Health and Health Connect, which is Android, data into a FHIR server. It can be EHR FHIR server or any. As for myself, I'm Raman. I'm a FHIR SME and trainer associating with Dogwood and FHIRly. So this project, it is a time to move campaign. This campaign has been started by Physical Activity Alliance Group in US. It's a multi-year project that will empower healthcare providers to seamlessly integrate physical activity clinical measures into patient care plans. This initiative has been supported by multiple organizations like HL7 International, CMS, NCQ, ONC, AMA, and many others. So we have this implementation. I think you can see my cursor here. So we have the physical activity implementation guide here, but from business perspective, what is happening is we have these three key players, which is care manager, service provider, and patient. So care manager basically overall manages the physical activity for the patients and what steps need to be taken, how, what are the targets, and when, right? So that's the job for care manager. And then we have service provider, which basically provides service to the patient. So you can envision that, for example, your exercise therapist, your gym provider, right? So that can be your service provider. And finally, patient, who needs the physical activity program. So this person will be doing a physical activity, reporting it back to care manager, and accordingly, the care plans and goals will be updated for the patient. So how does this happen in FHIR, right? So from assessment to reporting, so we have these different observations where we record physical activity data for the patient. We basically do assessments on how well this patient is doing. Are they meeting the guidelines? If yes, we actually maintain the physical activity care plan. We create the orders. We actually monitor how well that patient is doing based on the observations, and then finally the diagnostic report. So this is basically physical activity production ready reference implementations that we have built. Can you guys see my cursor? Okay. So this is the patient app which we have created, basically tracks the physical activity patient data. So you can see this patient has taken 400 steps, 800 calories for the day, resting heart rate was 60. This person can also create logs and reports. So you can see this person can create new activity data, they can add daily reports, they can add monthly reports as well. This person can see how well they're doing, right? So in terms of assessments, they can see, okay, this is my physical activity step data, heart rate, and so on. And then obviously, we're trying to simulate what did we do in the physical activity implementation guide. Remember, we talked about care manager, service provider, and patient. So basically simulating care manager and service provider in the provider app. So basically, we can simulate how you reflect care manager roles via this app or the service provider roles via this app as well. So you can log in as care manager, service provider. Obviously, we're just testing it out and trying to mimic how well these patient or reference implementations or provider reference implementation apps are doing. So these are two Smart on FHIR mobile apps. We have also created a physical activity FHIR server, which can create observations. We can create goals, prescriptions, referrals, tasks, conditions, diagnostic reports. And from the provider perspective, they can also create patients and provider as well. So if it's an admin provider, they can create a provider as well. So you might say at this point, you know what, Epic or Cerner, they already have the EHRs. Why you guys are doing that, right? So specifically, this has been created for FHIR Connectathons, working group meetings for testing it out. But when we were creating or releasing these apps out there and we were testing with the real clinics, it was realized that these clinics, they may not be associating with any EHRs. Like they don't have anything, right? So at this point, we start thinking about, can we leverage this FHIR server that we've created for actual gyms, right? They don't have any associations with these EHRs. Outcomes on this one was we did real-time testing with some of the clinics. I would say server didn't crash till the users were 15 to 20, and obviously it's cloud-based, we can scale it. But it has been tested for 10 to 15 patients logged in with a bunch of providers. So I decided to do an actual demo of the apps here, but because of the time constraints, I've actually recorded it, which might be better because of the timing constraints here. So I'm going to do a bit of a demo of both the apps and the Apple Health syncing as well. So this is our, oops, and I have to coordinate my talking with this recording. So this is our patient provider app. So we have a bit of an initial configuration screens where we're trying to, me as a patient, I'm trying to connect to my doctor's office, right? So when you're going to a doctor, he might be giving you some credentials, some QR code on how do you connect to his office, right? So this is that step. Let's connect to your health provider. So it may be done by some manually enter URL, or it can be done via this QR code as well. So it's asking for camera access, QR code scanned. You can see connection name, URL, and signing into the server, which is basically Keycloak. So in Keycloak, I'll just enter the username and password. I'm using my husband's account here because he's more physically active than myself. So we'll have more physical activity data that we'll see flowing from Apple Health. And just want to know, let you guys know that this is Apple phone, right? So, and same thing can happen on the Android as well, which will be Health Connect integration. But I'll show here Apple Health. So as a patient, I can connect to my cardiologist office, I can connect to my GP office, I can connect to my gym. So there is a possibility that I need to connect to all 3 FHIR servers, and I want to import my Apple Health data, and I need to share with all of these people, right? So this is possible. So that's where there is this feature that do you want to connect to another healthcare provider? I can say yes or no, but in this case, I'm just saying no, and proceeding with one connection here. So this is the step which basically says, do you want to sync your data with Apple Health? There's an option. I can say no, but I want to. So there are these different types of permissions that I can give Apple Health, which is read and write. So once I enable Apple Health, it's going to take me to the permissions page where I am, oops. Sorry. I maybe skipped to pains of recording and syncing it. So Apple Health connection allowed. So these are the measures that we have. These are the measures that we want to track as physical activity implementation guide. We sync the data, and you might see data syncing completed, import data successfully. So all of the data has been imported into this app now, and a FHIR resources has been created according to that. You can also track certain physical activity measures, like I want to do total exercise minutes. These are my vigorous exercise minutes. These are moderate. I want to track steps, heart rate, peak heart rate, and so on. So there are these steps that you can configure as part of this app as well. You can also select workouts as well, right? So activity selection is possible. You can see I'm adding basketball and other things here. These workouts are in sync with your Apple Health, and if you're logged in on the Android phone, it will be synced with your Android activities. So this is basically the landing page for the app. So you can see it basically gives you a high-level summary of what you have done today, which is total minutes of exercise, which is 0 minutes for now. But these are the steps, these are the calories, resting heart rate, all data imported from Apple Health. As a patient, I can also enter data into the app, which is basically I can create a new activity, I can add daily reports, I can add monthly reports, and if I'm adding new activities for each day, it basically aggregates to the daily report, and the daily report measures gets aggregated in the monthly report and so on. One thing about physical activity IG is we have like 4 KPI measures, which basically tracks over the period of last 30 days, how many days on an average did you exercise, right? So this KPI measures were all based on over the period of last 30 days, right? So that's why these monthly reports were so important to us. We are not just doing daily tracking, we are also aggregating it on the monthly level, which is last 30 days or last 5 weeks and so on. As a patient, I should be able to track like what are the tasks that are waiting for me, right? So provider can say, you have to talk to so-and-so exercise therapist, you have to review this exercise program on this particular URL and so on, right? So I have to ensure that I do all of these actions as a patient. So that's the main landing page. As I said, we can also add new activities. So when I did I did bicycle for 20 minutes today, and 300 calories, and 350 heart rate, which is not possible, right? So this might be syncing, and this data will be actually syncing into Apple Health. I'm thinking Apple Health should reject that, but for sure, exercise minutes should be synced to Apple Health. So you can see that update happened. And then further, we also have, as I said, our physical activity implementation guide were based on all the KPI measures were based on the over the period of last 30 days, right? So our stakeholders were demanding this view where we can see what happened on the course of last 5 weeks. So that's why we created another view here, which is called tracking chart, which basically tracks data per day, and under that day, you can actually track multiple your workouts or multiple activities as well. So this data automatically aggregates to the top level and so on. And you can see all of this data has been loaded from Apple Health. Now, I wanted to try one more thing. Can I update something in this app and see the results in Apple Health, right? So you can see I'm updating the calories here from 300 to 400. I did the update, and then I want to go back to Apple Health to see if the update has happened. So you can see my active energy is to 399. I've been not able to resolve the difference of 1 kilocalorie here, which is an existing bug that we know, but this sync is bidirectional here. And obviously you can track how was your experience and all of that. Data syncing has been an issue for us. You can imagine every number here is an observation FHIR resource. So we have been trying to do this data syncing issue, as in we're just dealing with the last 5 weeks data. Once you traverse to the other last 5 weeks data, then only we'll do the syncing process, as in generating of those FHIR resources, syncing it up with the FHIR server. So performance was the issue. You can do synchronization as well, right? So, and then I want to show you quickly As a patient, I can also do assessment of my own physical activity data, how well I'm doing. So that's another feature that's available here. As a patient, I'm able to see plans and goals related to me. So I can see what are the conditions that exist for me, goals, physical activity plans, prescriptions, and referrals. So you can see I have like 3 conditions, 2 active goals. I can also create my goals as a patient and send it to provider as well. And I have care plans, referrals, and exercise prescriptions. And as I said, I can also create my goals. In terms of settings of this app, since we have been heavily using this in the FHIR Connect-a-thons and working group meetings, we are trying to play around with these different settings. For testing mode, we have also left diagnostic mode on. So when we're testing, when we're creating something, we want to ensure what actual FHIR resources have been created. So that's why I've left diagnostic mode on here. But in the real production-ready version, you'll not be able to see that. There's a possibility that I really don't want to send this data daily, or maybe I want to send this data weekly to my provider, right? So there's a syncing time option that I can set as in my app. I can enable, disable auto calculations and so on. I can also disable Apple Health. And this is where you can actually update your FHIR server connections. And let's say if you want to connect to Epic or Cerner and so on, right? So you can change your FHIR connection settings here as well. Am I doing good on the time? 2, yeah, just last 2 minutes. I just quickly want to give the provider app demo as well. So this app, you can, as I said, you can also log in as care manager and service provider as well. I'm logging in as a care manager with admin access here. So obviously, as a patient app, this one would have some initial configuration screens. And since these are like standalone mobile apps, I would need those connection URLs and passwords, right? So to connect to this app. So same thing, I will connect to, took me to a Keycloak FHIR server, enter the username, password. And this is the main landing page for the provider app, right? So as a provider, I need to do what are the tasks that are assigned to me, any referrals that are coming in, any referrals that I've sent and that have been responded, I need to see here on the to-do screen. Patients, this is a list of patients for myself. And since this is an admin provider, I can also add new providers to the system as well. That will be synced with the Keycloak user management. So from the patient app, I can see all of my patients here, and then I can select any of the patients. So this is the patient I've selected. I want to review how this person is doing on their physical activity data. Same thing, you can actually see that this person has, these are the main KPI measures I was talking about. So these are the 4 KPI measures. This person has exercised for 4 days per week, for 42 minutes. On an average, 168 minutes per week this person has exercised, and 1 strength day for that week. I can see what are his physical activity, health-related and activity management stuff, right? So you can see all of these conditions. And as a provider, I can create all of these conditions as well, right? So I do have permissions to update what patient has created as well. I can also assess how my patient is doing, and also in edit-only mode, I can see in detail what happened over the course of last 5 weeks data as well. And that's all. Thank you. Sorry about that. These are the important links for the IG HL7 conference page. our physical activity Zulip page, and how do you connect to these reference implementations. If you guys want to play around with the apps, we have the connection details, and I can set up your username here in the apps so that you can do some testing.
Thank you. I think we will have no excuse not to exercise soon. We are already a bit over time, but it's a break now, so I think I will just take a few questions if there are, and then I will
Sounds good.
give it.
Thanks for that presentation. That was great. Was Keycloak playing the role of your PCPs, like FHIR and Smart Server? And did I understand that right? And then you kind of did the FHIR download, comes into Apple, and then you connect it to Apple Health, and then your mobile application is pulling data from Apple Health. Or if that's wrong, could you correct me on what that data flow is?
So my apps connect to the FHIR server, which is FHIR-based. So underlying, we're using FHIR library to create but the user authentication, authorization, user management is happening in Keycloak. So we did do that connection. In terms of data flow, we log into the app, we import data from Apple Health, we create those FHIR resources on the background, and then we sync it with the FHIR server.
If there were no reference implementations, and this was in a real-world production use case, would Keycloak still be involved?
No.
Would Happy still be involved? Yes, as an underlying data store for your app, right?
Yeah,
okay. Yeah, that makes sense. Thank you.
Yeah. So there would be changes in that authorization and all of that. Yeah.
I don't. There is one more question.
Thank you. I tried out your application in Apple Store, but didn't found how I can download it.
Sorry, can you repeat that?
How I can download this application?
Oh, yes, definitely. So we do have if I go to takes forever, but we do have the public links for the App Store. And also for Android, we have APKs generated, which is publicly available. So if you follow this Zulip link, you'll be able to see how do you connect to our server. So there are these QR codes available. One thing you want to ensure that, so this is it, right? So if you want to join us in any of the FHIR Connect-a-thons testing this, these are iOS users for public link for the physical activity patient app, and this one is for the provider app. For Androids, these are the APKs, so you can just link to that, and you should be able to test this in the test flight. When it comes to server, this is the QR code for the physical activity FHIR server. And if you're planning to use this, let me know. I can create additional accounts for you. These are test accounts. We are using this, and it has our own physical activity data, so we really don't want to mess that up. So let me know if you're planning to use that. We can definitely create more accounts.
Okay, thanks, Raman.
Thank you.
So I will now end the session. Please don't hesitate to provide feedback. If you have further questions, you can always do it with Wova, and I think you can enjoy the break now. Thank you.